Queenslanders in there celebrating the State of Origin to be held next week up in Townsville, and it's great to have the State of Origin team being backed by Queensland, and we're going to show them a huge support for next week. But today I just want to talk to you briefly about the vaccination hubs that will be open up across parts of Queensland over the weekend, and Minister Darth, as our Health Minister, will give some more detail. It's absolutely imperative that we have someone that's front and centre to make sure that this vaccination rollout goes well. But more than that, when we come up to September and October, we know that there is going to be more supply coming from the Commonwealth, as was stated clearly by the Prime Minister and the Chief Medical Officer today, and there will be mass vaccination hubs. Queensland is the most decentralised state, and we know that there is going to be a big need for coordination across our state. So just as we have a state disaster coordinator when we deal with natural disasters, I am now appointing Deputy Commissioner Shane Schleppi as our vaccine coordinator. So that comes into effect from today. I signed it last night, and that means that Shane will work very closely with Health to ensure that the messaging is getting out about who can come forward and get vaccinated, to make sure that we have our community recovery and SES and support staff there to aid people, and also to talk about the coordination in terms of that the priority at the moment is on the 40 to 49-year-olds. So I believe that Shane, with over his 30 years experience in the police service, is the right person for this job. He has the complete blessing of the Police Commissioner, Katarina Carroll, and he will be front and centre to ensure that the progress of the mass vaccination across Queensland is rolled out. So I'll hand over to Yvette to say a few words, and then the Deputy Commissioner's here as well.
Thank you, Commissioner and Premier. It's great to have the Deputy Commissioner on board as we move into a much larger logistics exercise, setting up our community hubs and preparing for our mass vaccination centres to come online closer to October, when we are expecting large volumes of Pfizer into the country. Great news for this weekend. First, I want to thank all of our staff, because we did a record number yesterday, 10,088 vaccinations yesterday, and I'm sure we'll see same sort of numbers today. But of course we have our community hubs operating for the first time this weekend. Again, this is for staff who are engaged at residential, aged care or disability facilities, frontline workers in health, police, paramedics, emergency service, correctional services staff, and 40 to 49-year-olds who have registered. So they're the ones we want coming out. Now, we know that there's people coming to our sites who are outside of that age group or that work area. My message to you is this: you are likely to be waiting a very long time, and you may not get a vaccine at all, because we will prioritise those in this group. We have set our first and foremost residential aged care and disability workers, and then our 40 to 49 age group. Now, for those who are eligible and are coming out on the weekend, can I just give you a bit of an update? So our Logan Entertainment Centre is already fully booked for tomorrow, but there is still spots available for Sunday. Rocklea Showgrounds also fully booked for Saturday. We still have some spots on Sunday. We do have vacancies available at Springfield Tower over the whole weekend, so you can jump online for them. And of course, a lot of our regional sites, there are still spots available both Saturday and Sunday, but some of our big hospitals are already full. So Ipswich and PA are already full, and Gold Coast Hospital's already fully booked for Saturday. So please keep an eye on our social media. We will post again tomorrow, once we have the final figures for today, where there are still vacancies and where we're fully booked. If we're fully booked, please don't come unless you've got a booking, because you do run the risk that you're going to be lining up for a long time. But we are so excited about this weekend. I want to thank the Deputy Commissioner for coming on board and helping us with the logistics. This is a huge exercise, but Queensland up to the task, and we've already shown with over 35,000 vaccinations in the first 4 days this week that we are just smashing it out of the park, and we're really excited about what we can do this weekend.
Thank you, Premier. Thank you, Minister. Thank you for the invitation to come on board. I'm so pleased to come on board to assist in the vaccine rollout in Queensland. As always, when we do these big logistical exercises and operational exercises, as we've done during our disasters across the state in the last 10 years, we've brought the whole of government power through the disaster management framework to roll out these big operations, and this is no different. The vaccine rollout in Queensland is going to be a big operation. Queensland Health have done a fantastic job to date, but we're about to take it to the next 2 levels. We're about to roll out our community hubs with the first 3 this weekend, and then obviously we're doing some detailed planning around some mass vaccination sites later in the year when we know that the supply's there. So I really am looking forward to working with Queensland Health and all the government departments, as well as all levels of government in the planning to roll out the vaccine rollout to as many Queenslanders as we can. So thank you. Thank you, Premier.
Minister, you just asked, those that are fully booked, all those people who are booked at Logan, Rockby, Shrinkland, how do they get notified to come in tomorrow?
So when we say they're fully booked, so these people... So wonderful fire and emergency services at work. So when we say they're fully booked, it's because people have registered, we have invited them to make a booking, and they are fully booked in. Now, I do ask, if you've got a booking, please turn up. We would hate to see people missing that opportunity and spare vaccine at the end of the day. So if you're booked, turn up. I have no doubt there's a lot of interest to take up those bookings, but they are booked in. They've already been notified of their booking. Yes, yes. Well, what we've said all along is we want you to book. Now, of course, we're not going to refuse people who walk in, but the risk is you could be waiting hours and you could end up not getting vaccinated at all that day, especially when you're outside of the groups that we have said are eligible for this weekend. If we get through all of our bookings and we have spare vaccine at the end of the day, then sure, we're not going to waste that. But let's be clear, make sure you're letting the people who are being prioritised this weekend, who are already registered and in the groups that we've announced, to get their vaccine first. And we don't want to waste your time, and I don't want you lining up for hours unnecessarily. So please make a booking so you can end up being vaccinated on time as planned.
The Gold Coast today, people were given a choice, Pfizer or AstraZeneca, regardless of their age or their grouping. Will that happen this weekend? Can they choose whatever?
Look, this is what we've said, is these hubs are set up for Pfizer. There is a small amount of AstraZeneca at some of these sites, but we are not encouraging, we are not inviting people who are 50 plus to turn up these sites to get vaccinated instead of going to their GP. Please go to your GP, consult with your GP about the vaccination, what's suitable to you. This is available for residential aged care and disability workers, 40 to 49-year-olds, and also frontline workers. That's what this weekend's about.
I might just say something.
Sure.
So look, at National Cabinet today too, look, we see it as an absolute priority for our aged care workers and disability care workers to get vaccinated as quickly as possible. So they will be getting priority this weekend, so I hope the public can understand that, plus those people who have made bookings. So down the track, we're going to have a lot of supply coming from the federal government in the last quarter of this year, and there'll be a lot of opportunity for people then. So please, everyone, be patient. And in the meantime, I encourage people to go and see their doctor.
Premier on regional quarantine.
Yes.
Is the WellCare proposal now fully off the table?
No, we've actually been speaking very regularly with the Commonwealth officials, so it's there's a lot of negotiations still happening.
Are you disappointed that the Victorian one seems to be...
Look, I can understand that the federal government wants to prioritise that facility, considering what Victoria is going through. And we will continue to work with our regional quarantine facility with the federal government.
Is the difference between the Victorian and the WellCare facility? Is the difference that the Victorian facility would complement hotel quarantine and perhaps the WellCare facility would in Queensland replace hotel quarantine?
No, that's not correct.
Would Queensland look at the Victorian plan and that they've done as
Our officials have already been speaking with the Victorian government as well.
So
There's a lot of negotiations that are happening, and in the spirit of cooperation, I hope that those discussions are being met from our end as they should be being met from the
So
Commonwealth end.
Queensland is speaking with the Victorian officials around
Yes,
how this works.
yeah, no, we're talking about what they're doing. We've got our own plans. So, you know, what I think Queenslanders are saying very clearly to me is that they want to see regional quarantine facilities. If they're saying that in Queensland, I'm quite sure they're saying it across the nation.
Premier,
And I see a member of the public nodding in the background there as well.
Premier, do you support the mandatory vaccination of aged care workers?
I think what we need to see is people getting vaccinated as quickly as possible in those settings. I think that's a priority. I understand that there's a lot of people from different ethnic backgrounds as well. We need to get the messaging out to them. But National Cabinet had a good discussion about that today, and we absolutely determined that the priority is to encourage those workers to get vaccinated as quickly and as soon as possible. And that's why the state government's stepping in and helping with that.
So you don't support mandating it?
Well, I think I think first and foremost we've got to get the aged care residents, make sure they're all vaccinated, and then we need to move on to the workers, and that's essential. Last question.
The big rally today, a couple of thousand people. Two issues there: Q bills and state privatisation.
No,
Contract.
that's not true.
The other issue is
Yeah, well, that's the matter for the PCCC is the parliamentary body that overlooks the CCC, so that's best directed to them. And you know, my government brought back Q Bill. We know how important that is, and we've got Q Bill workers we want to get involved in the regions, and that's a priority for us. Okay,
Gotta go.
Thank you.
Can I just ask one more on hotel quarantine?
Last one, you're lucky last.
Thank
Yes,
you very
I'm in a good mood today.
Very good. A few wines in there.
No, only half a glass.
Okay. Just on hotel quarantine, the federal government's issue was that there wasn't enough detail in the original plan for Wellcamp.
Yeah.
There's a very big machine behind your government. Have you gone back to the federal government now and filled that out?
All I can say is that there's a lot of discussions happening between the two agencies, and that's good. That's how it should be. And I reiterated that today at National Cabinet.
So just discussions? Or
Okay.
no, you
Lots of
haven't gone back with a
discussions.
better...
Lots of discussions.
Gotta go. Thank you.
Oh, thank you so much.
Queensland